pay kickbacks to both physicians and pharmacies for prescribing and promoting these drugs.
Closer look at the charges now. The pharmaceutical giants pleaded guilty to the charge that they unlawfully marketed an anti-psychotic drug called Risperdal and 2 other drugs. Risperdal was approved by the Federal Drug Administration to treat schizophrenia, but was marketed to doctors and nursing homes as a treatment for elderly patients with dementia. The settlement includes criminal fines totaling $485 million and civil settlements of $1.72 billion. That includes a $167 million payment to the whistleblowers who originally brought the claim against Johnson & Johnson. Well, this penalty account amounts to one of the country's largest healthcare-related settlements. So let's talk to Jeffrey Kraws, a senior pharmaceutical analyst at Crystal Research Associates, joining us now from New York. Is there any kind of moral judgment in this? Because the young, the elderly, the infirm, all vulnerable people were targeted by this pharmaceutical company extremely cynically.
Yeah, certainly it was an ethical violation in addition to I think a moral violation, in that they went after people who otherwise may not be able to make the decision for themselves, and in fact promoted the use of these drugs off-label, clearly not letting the patients know, or not having the patients capable of understanding for themselves what the ramifications of utilizing that drug may be.
So they were using Risperdal. This is the one that we've highlighted here to treat things such as anxiety, agitation, depression, hostility, confusion, when it should only have been used for schizophrenia. How were they able to circumvent the FDA rules on this?
Well, the FDA repeatedly said that they issued warnings to them about setting up this marketing tactic about going for off-label use, and despite continued and repeated warnings from the FDA, they set up a basically marketing sales force to market to these nursing homes. And what they did is they put forth claims that were not supported factually. They were able to coerce physicians through kickbacks, and surprisingly were able to get the Omnicare, the largest pharmacy which caters to nursing homes, through also basically bribes and kickbacks of millions of dollars, to take these drugs on and put them forth for indications that were not scientifically validated or backed.
Do you think they were buying doctors off?
Oh, they certainly were buying doctors' opinions to help doctors push drugs through there, and it certainly is reprehensible, yes.
And in terms of the after effects of this, they can still carry on selling. Do you believe they've perhaps got off relatively lightly?
I think they did get off relatively lightly, and I think that was sort of ingenious to their counsel, because somehow they've been able to continue, they will be able to continue to deal with Medicare and other government agencies and nursing homes going forward. They had to put forth a 5-year integrity plan to modify their compensation to sales reps and to adhere to good behavior, but certainly got off very lightly, considering there's no real impact on earnings because they've been accruing for this for the last 2 years.
And what about the reason why no criminal charges were brought? Because in some instances this drug, Risperdal, particularly in the elderly, can induce strokes, and indeed did, and therefore may have led to premature deaths among some of the people who took it.
No, agreed. And, you know, for a company with a $65 billion top line, there obviously is tremendous exposure, especially with some of the lawsuits this company has faced in the past. And it's going to be a true struggle for them to really get their brand image back as, you know, the consumer caring company. It's a shame, but, yeah, they certainly feel like they got off lightly compared to what the damages and what these suits could have been.
Well, thank you very much indeed. That's Jeffrey Kraws talking to us from Washington, D.C. Or from New York, I do beg your pardon. Pakistan